Hi, I'm Lizzie. And I'm Mary Leah, and we're going to be talking about swine biosecurity and production. So, to start, I'm going to talk about the immune system of swine and some brief similarities and differences from humans. So, overall, their immune system is 80% similar to humans. This makes them a really important model for immunology study and even testing drugs because it is so similar. We can um, test that a little easier in before we go to human trials. They have similar anatomy of immune tissues as well as an innate and adaptive immune response, just like humans. They also have 10 toll-like receptors, express CD16, and have a similar neutrophil protease. These all make it similar to humans, but there's also some differences. A lot of these are pretty specific, and I had to do some digging to find them. But they have more diversity of interferon type 1. They have 39 genes. We have 19 genes. They have no induction of the NOS2 response to LPS. They have more cathelicidin genes and no alpha defensins. They also have duplications of certain genes to allow some redundancy in their immune system. So these differences, we've learned about a lot of these aspects, and as much as it is pretty similar to humans, it does affect their signaling pathways and how they recognize and attack pathogens. And it's going to be really important to understanding how different epidemics can affect swine production. And Lizzie's going to talk about some pathogens now to get a scope of what dangers that we're facing in the swine production industry.
So now that we have talked about the swine immune system a little bit, let's now talk about pathogens that might be common in the swine industry. So we had interviewed Dr. Elizabeth Howarth, who has her DMV and specializes in pathology. She works at the College of Veterinary Medicine for UGA. And in the interview, we had asked her what were some common pathogens, maybe some pathogens that were concern specifically for swine, and pathogens that are a concern for the handler if they were to contract it. So, first off, we'll start talking about common pathogens that are a concern for the pig, and this would be Lawsonia intercellaris, influenza A virus, Mycoplasma hypopneumonia, and then pathogens that are more of a concern for the handler that she had mentioned were rabies virus, pseudorabies virus, which is more rare, but still a big concern if it were contracted, Brucella suis, which is a more common one. Other pathogens that we're going to talk about that we did not mention with Dr. Howarth, but we saw in research were E. coli and African swine fever. So, starting with Lawsonia intracellaris, it is a gram-negative bacteria and causes porcine epidemic diarrhea virus. So, we can see these little more brown stains in the images. This is Lawsonia intracellaris. And the infection may occur after the bacteria enters the epithelial cell, typically by a vacuole, and then it will multiply there in the cell. And we'll see 3 days after there will be inflammation, neutrophils, and then on 7 days, there will be proliferation of the epithelium in the intestine, specifically in the small intestine. Dr. Howarth said that it's more common for the infection to be seen in the small intestine than in the large intestine, although um, it might still be possible that there is infection in the large intestine. There will also be neutrophils and macrophages seen at this time. And transmission is typically by contact or feces, and it will result in a thick intestinal mucosa, which is again typically in the small intestine. And then Dr. Howarth said there will be decreased weight gain, as well as diarrhea, sudden death, hemorrhage, and necrosis. Now we'll talk about influenza A virus, which is a single-stranded RNA virus, which has an envelope. It causes swine influenza, which is very common in the swine industry, and is zoonotic as well. So not only is it endemic for swine, so it's kind of always present, even at low numbers in the population, but it is also could be common for humans to get it as well, but it's not that much of a concern as it'll just cause common flu symptoms for the handler. It may have a seasonal infection, so heightened in the winter and the spring seasons, but it is a highly infectious um, agent, which is why it is very important um, to be cautious of this as you develop swine maintenance plans. This is especially as the carriers can pass infection without displaying signs. Um, Transmission may be through direct contact, air, and respiratory secretions. And this may result in respiratory infection, weight loss, and reduced growth. Dr. Howarth was quoted about this virus saying that it infects the lung, causing interstitial pneumonia, depression, coughing, difficulty breathing, high fever, and sometimes sudden death. It can be more severe if coupled with another virus like Lawsonia interstellaris and Mycoplasma pneumonia. So now we can talk about Mycoplasma pneumonia. This is a gram-negative bacteria, which causes swine mycoplasmosis, which is an epizootic pneumonia. And we can see here in this picture, these more kind of flaky things on the outside of this tissue is Mycoplasma pneumonia, the brown stain. So Dr. Howarth had mentioned about this pathogen that there are a couple different ones. Some infect the lungs, causing pneumonia, and others cause a polyserositis. It is highly infectious agent, and vaccines are usually not helpful to limit transmission after infection, but ways to limit it before infection are by management and preventative vaccine. Transmission is typically by nose to nose contact, air, and respiratory secretion. And during the nursery period, typically by suckling, is when the transmission is at a higher risk. And it may result in respiratory infection or cough. Now we will talk about rabies virus, which is part of the Rhabdoviridae family. It's a single-stranded RNA virus, which causes rabies. It's zoonotic, so it is a risk to the handler. And the infection typically happens as it travels to the central nervous system, may cause some degradation and inflammation of the spinal cord and the brain. Um, and then after that, it will then travel to the salivary gland, where it may then be able to spread to new hosts. So it's important to reduce this risk in the swine unit by um, giving rabies vaccines to the pigs. Transmission is typically by saliva, so when one is bitten, and Dr. Howarth also mentioned by open wound or brain at necropsy, which is important as a handler may be dealing with an animal who has died from rabies. It will result in neurologic things, neurologic effect, as well as fever, tachycardia, anxiety, insomnia, hydrophobia, and it is fatal. So the encephalitic type is the most common and leads to loss in brain function as well as the limbic system. And when humans may get the disease, um, they may have spasms, hallucination, paralysis, or maybe have a coma. And in testing, it's very important because even the host can be affected by low antigen present. It's important that in testing, they're aware of false negatives as it may not pick up these low levels of antigen. In this image here, we can see um, the rabies as well as this is the inflammation of fighting back the rabies virus that is present um, in the tissue. Next, we'll talk about pseudorabies virus, which is a double-stranded DNA virus and causes pseudorabies, which is also called the mad itch in cattle. It's an epizoonotic disease, specifically for pigs, as it's its natural host. And the transmission may be oral, and the carrier can shed the infection by saliva. Um, it's important that we can reduce transmission with preventative vaccines. So, again, as one considers how their management style will be in the swine unit, it's important to maybe implement plans that contain these preventative vaccines for these um, more common pathogens or pathogens that might have a great effect on the animal or a handler. Some results are damage to the nervous system, um, death and reproductive failure in the sow specifically. And it can be serious if humans are infected as well, as it can result in death. Next, we'll talk about Brucella suis, which is a gram-negative bacteria with an envelope. It causes swine brucellosis. It's zoonotic and can be an animal. Animals can be a reservoir for this bacteria to humans, to get to humans. The infection typically occurs first through the bacteria goes through the mucosa membrane, then transports by a phagocytic cell um, to the lymph nodes where it will then reproduce. And then from there, it will go to the rest of the body where it can then shed by the mucus and in the male, the semen to other hosts. Transmission is typically by direct contact. And a result of this may be chronic infection, abortion, orchitis, abscess in the testicle, anorexia, and fever. Right now, there are no current vaccines to prevent this infection. So it's important to maybe isolate those that might be infected to reduce spreading. Next, we'll talk about E. coli, Escherichia coli. This is a gram-negative bacteria, and it causes STEC. STEC produces a cytotoxin, which is also called a virotoxin. It is typically a foodborne pathogen and can be person to person in humans, and it can also be contracted via airborne pathways as well. It's important to be aware of E. coli as it can shed months after infection. And the result of being infected can result in oedema, renal failure, diarrhea, damage to the epithelial cell in pigs specifically. And in this picture, we can see the rods of E. coli in the tissue. And then the last pathogen that we're going to go through specifically is African swine fever. This is a double-stranded DNA virus which causes African swine fever. It targets macrophages to replicate, and the transmission is through direct contact, oral, nasal, open wounds, air, and ingestion. And if the pathogen does get into the blood, then it can also shed via urine, feces, and saliva. And then in East Africa, they are to be aware of transmission through soft ticks, but that's not as common in the US. A result may be fever, anorexia, lethargy, which will specifically be seen 3 to 4 days after infection, and then decline in health, great decline in health, bloody diarrhea, vomit, and possible abortion. We can see in this image the African swine fever taking effect in the tissue. Some of the pathogens that we have talked about have been gram-negative, single-stranded RNA, as well as double-stranded RNA. So I wanted to take a few minutes to talk about how the immune system may react when coming in contact with these specific structures. So starting with gram-negative, specifically for Brucella suis, we may see a decrease in stimulation of pattern recognition receptors, which will be like toll-like receptors, as well as the immune response to LPS. So differing from gram-positive cell, which has lipoteichoic acids, the gram-negative cell contains lipopolysaccharides. So the immune system may use this as a recognition for the gram-negative pathogen. The innate immune system may also create cytokines, which will then help the adaptive Th1 pathway. And in this image, we may see how a phosphorylation cascade is created in response to the gram-negative pathogen, which would then create cytokines and type 1 IFNs. Secondly, we'll talk about single-stranded RNA, which toll-like receptors will use nucleic acids in the single-stranded RNA to then become targets for the innate immune system to attack. The PRR may also recognize PAMPs from the pathogen, and it's important to note that viral proteins are very similar to host proteins as they have to use the host to replicate. So PAMPs will be then the most triggering stimulus in order to decrease the chance of accidentally attacking the host, like the immune system attacking itself. So this is why recognition of viral nucleic acids would be more important in this step. And this would then stimulate INF beta specifically, which would then lead to apoptosis. Toll-like receptors may also activate dendritic cells, eosinophiles, neutrophils, mast cells, as well as some others. And the presence of this pathogen would, in this image, we see result in type 1 IFNs as well as cytokines. So lastly, talking about double-stranded DNA, we will see that the immune system, again, uses PAMPs to stimulate dendritic cell response. And these dendritic cells are the antigen-presenting cells, so they will become very important in further immune response. And the presence of the double-stranded DNA also produces a cascade of mechanisms, as we can see here in the image, which will result in producing type 1 IFNs as well. And these IFNs specifically will hinder the replication of the virus. So not only that, but IFNs are important as they are kind of the link between the innate and the adaptive immune system, as they signal for several cells such as macrophages, neutrophils, T cells, and B cells, as well as some others. That is the main function or importance of these IFNs, is that they are the link between the innate and the adaptive immune system, or one of them.
So now I'm going to get into an overview of biosecurity, and then I'll delve into some of the specific protocols that are used in the swine production industry to protect from these pathogens that Lizzie has mentioned. The overall goal is obviously to reduce disease, but also antibiotic use. This contributes to a prevention of antibiotic resistance as well as decreasing costs for producers and consumers. Current protocols are really based in isolation and sterile environments, as well as having defined clean and dirty zones. But pathogens are inevitable, but reduction is really what's important to this industry. Ultimately, success is determined by management and how rigidly these protocols are being followed. Complacency is one of the biggest risks in this industry, but sticking to these can have a great effect on reducing disease in these farms. So to start, location, farms should be as far away as possible from any activity, especially other swine operations. This is at least 1.5 miles from other farms. Further, never hurts, but this decision on a location should account for wind and locations of wildlife. Flat areas with no trees, pathogens can be carried farther by wind, as well as, if you're adjacent to a forest, you may want to move a little farther away to prevent the amount of wildlife that can come in and potentially interact with your animals. Buildings on the facility should be separated by at least 50 yards between them, and these should all be at least 100 yards from a public road. Further, it never hurts, especially if the road is known to have common swine transit. And then lastly, a chain link fence with posted warning should surround the whole perimeter. This keeps unwanted people and animals out of the facility and provides a good barrier to know where you have to, delve into cleaner on the farm to limit pathogen transfer. So as you can see here, this fence that's really close to the camera would be the perimeter fence. And then this one kind of surrounding all these buildings would be the biosecurity fence. As you can see, the feed dispensers are all located outside of this biosecurity fence to limit this potential for feed to spill and also for delivery. They don't have to enter this biosecurity fence to drop off feed. So this area past here would be clean, but this just provides extra separation to limit the amount of pathogens that are actually entering these buildings where the swine are housed. So human contact should be as limited as possible. The employees and visitors should have no other contact with pigs outside the facility. This means no family swine farms if you're working in one of these plants. Kitchen and amenities should be provided on farm. Just anything that allows employees to stay on farm during lunch and not leave in the middle of the workday and potentially track pathogens back in. Then a sign-in book with detailed records is important to trace possible outbreaks. This is important for the humans as well as the swine. We can assess the risk and, see if it's potential that this human got a disease from swine and could give it to other humans, or vice versa, and then a human brought it in and we want to know where that came from. And then shower in and shower out is important and a complete change of clothes for visitors and employees. These locker rooms will have a clean and a dirty side where you'll come in, remove your outside clothes, shower, and then put on farm clothes just to limit the amount of pathogens that can come in on your skin and your clothing. Ideally, different groups in buildings should be tended to by separate people. As for example, someone may do the nursery pigs, someone else may do the oldest sows. If that's not possible, do these from high to low health risk. So again, you're going to do the nursery pigs first and the oldest sows last because the older pigs are going to have a higher pathogen load, even if they're healthy, and we don't want to contaminate that down to the susceptible ones. So as you can see here, this bench provides a barrier. It's really all about clear separation and lines between these clean and dirty areas. So your shoes from off farm will be left over there before you put on your slip-on shoes over this bench and continue traveling into the showers, locker rooms, whatnot. These individual changing rooms reduce the need for separate locker rooms for men and women, and they can be found on the clean and dirty side. So one will be to, take off your on-farm clothing before you shower. The next to put on-farm clothing. So it's pretty nice setup, but it's important to have these clear barriers is really the takeaway here. So pig flow, pigs are moved in an all-in, all-out manner, where groups of the same age are moved together and then stay together throughout their life. It's important to, it's good to keep less than a 14-day age spread within these groups just to ensure that they've been exposed to the same pathogens throughout their life and they're not, mixing, bringing in more stuff. It's important to disinfect rooms or buildings between groups of pigs. This is power washing with hot water, as well as chemical disinfection. And letting the room dry for at least 6 to 8 hours is important to make sure this disinfectant works properly. Separate rooms or buildings for newborns, weaned, feeder, and breeding pigs. Just want to keep these age groups separate again to reduce the amount of pathogen load transferred between the age groups. And then again, limit cross fostering within the first 24 hours of birth, and euthanizing sick piglets are all important to keeping a disease-free facility. So for the facilities and loadout zones for their setup, naturally ventilated buildings should have screens to keep out insects, birds, and other wildlife, just to limit what they can be bringing in. Um, Facilities should be kept clean to ensure that mice and rats don't have access to food and water, and this will limit their potential for infestation. Materials and equipment should all be easy to clean, and anything brought in to fix anything or replace anything should be either new or fully disinfected, or both could never hurt. Foot baths at the entrance to rooms and buildings should be changed frequently, at a minimum daily, but depending on how much traffic they get, probably more than that. And staff should note that fecal matter on their boots that doesn't get washed off, it's not getting disinfected all the way by this foot bath. So it's important to, make sure your boots are rinsed off before you do that if you're needing them to be completely disinfected. And then loadout zones should be on or outside the perimeter of the perimeter to the facility. We don't want these trucks coming all the way in to the front of these buildings in areas where other swine and humans may travel in between buildings. And again, the truck should be disinfected between groups of pigs. So as you can see, here's kind of a model. This can be scaled up or down, and these are not all accurate sizes of these areas, but this yellow zone with the center alleyway in the barn, this would be the clean area. And then theoretically, the truck should be clean as well, but because it's coming from outside, there's really no guarantee about that. So it should be as disinfected as possible, but can be treated as a dirty area just for security. And this buffer zone is really important. This will be the area that pigs travel through before they get on the truck. But what's important here is that they cannot turn around from this area. So say you're only moving half of these, you don't want pigs to get on, get out of this area, get outside, get on the truck, and then turn around and come back in and potentially bring pathogens from outside into the barn. So this buffer zone is really important. They cannot turn around from there, and this just, limits the potential for contamination on the farm. And this line of separation would ideally be the perimeter of the farm. So this can also be scaled. Some farms do this where the center alleyway is included in the buffer zone, and just each of these little pins would be clean. And this buffer zone may be a large stretch of area outside. It can be scaled differently, but just the basic principles of they cannot turn around from this buffer zone are really important. So sick pigs, new animals, and mortality, these are all inevitable, and there should be an isolation building for sick animals at least 500 yards from other buildings. New animals will need to enter a quarantine period and be blood tested for a variety of diseases. This is a 30-day quarantine, 30-day acclimation period. New animals, even though they will still have a quarantine and blood testing period, they should still come from a farm with known good biosecurity protocols. Just again, you want to know where your animals are coming from and be able to trace anything that happens. And then the same goes for semen for artificial insemination. There are some diseases that can be transferred in this manner, and so it needs to come from a place that has good biosecurity protocols. And then dead pigs should be taken off site at least daily, because they can become a reservoir and also attract rodents. So just to limit any potential for pathogen transfer, they should be taken off as soon as possible to whatever dump site that facility has. Transportation. I spoke with Dr. Dove, and he believes that transportation is the weakest link in the swine biosecurity industry. A lot of these transport truck drivers are not technically employed by that farm. They're hired from an outside service because the startup cost of buying all these trucks, hiring drivers is pretty steep, and so it's a lot easier to just source through these companies that transport livestock. But the point there is that they can't be managed as closely by the farm managers. They often walk through the entire facility, sometimes without changing boots or clothes. to either drop off paperwork or, let someone know they're there. Dr. Dove mentioned a study during the PED epidemic where convenience store floors near farms that truck drivers were known to often enter in between trips were sampled, and roughly 90% of them, PED could be cultured off the floor. Now, this really demonstrates how big of a risk that it poses for these people to be going between different farms, coming from outside. We don't want them bringing pathogens into the farm. So it's really important to teach biosecurity and why it's so important, and have as much management as possible over them, and also making sure that the trucks are clean in between each different transport of groups is very important to reducing disease. So that was a lot of biosecurity protocols I just threw at you, but why is it important? So there are some very large economic risks to outbreaks of some of these diseases that affect swine. For example, Japanese encephalitis virus, roughly 32% of the US herd would be susceptible, and it could cost about 300 to $600 million. And that's pretty steep, but it also gets worse. An African swine fever outbreak could cost $79.5 billion and account for 60,000 job losses. This is, again, pretty steep and could really have an effect on our food supply and our economy. And now the porcine epidemic diarrhea virus that I've mentioned, PED, we've actually had issues with it in the US beginning in 2013, but a 3% reduction in pigs could cost about $481 million, and it's double that, and a 66% reduction costs about $929 million. So all of these would have huge economic impacts on the United States, and we would like to avoid that. So, ASF and foot and mouth disease are more of a global concern right now. Their outbreaks are very difficult to control and result in mass slaughter of infected animals. And then porcine reproductive and respiratory syndrome and PED, according to Dr. Dove, represent the largest economic concern for us in the US right now. Outbreaks not only affect our food supply, but they also affect importation and exportation of goods. For example, if we know of a country where there's an outbreak going on, we're not going to be importing a ton of pork from them. Same goes for them. If we have an outbreak going on, they're not going to want our pork. So that can have an effect on the economy. And then, so as we know, consumers often don't understand the meat inspection system and how careful it is to not allow diseased animals into the food supply. But consumer desire to purchase pork products can be affected by an outbreak. Even if this piece of pork they're buying has no disease on it, they hear African swine fever and it's scary, and they don't want to put themselves, what they believe, is at risk. So, what's the disease risk to humans? Obviously, there's quite the economic risk to us, but there are also a lot of known zoonotic diseases that affect swine and humans. And here's some examples there. I know Lizzie's talked about a lot of these, but according to Dr. Dove, influenza is the largest zoonotic concern for humans. And then the pig is also an amplifier host for some diseases, and can make them worse before they transmit them to us. Then human to human transmission after exposure to these swine diseases has been reported. Treatment right now is just supportive care, but there's definitely a risk of getting sick from pigs. And then antimicrobial resistance is also a growing issue, as it is with everything, especially in livestock, that we don't want to be contributing to this antibiotic resistance of things that we need for our own health. So, some more information from this time from Dr. Howarth is that some more diseases that are at risk is, of course, rabies is fatal. And then influenza transmission, I mentioned, is a big zoonotic one, but it's the same as human seasonal flu, and flu symptoms are typically manageable. You're likely not going to die if you get influenza from a pig. Pseudorabies is very dangerous and deadly, but not very common. And then brucella can be transmitted zoonotically, and then so those are all known ones that are really dangerous, but the industry is also closely watching HPAI, highly pathogenic avian influenza, that we know has made a recent zoonotic conversion to the dairy industry and is also affecting humans. So keeping a close eye on that to make sure that it doesn't cause an outbreak in the swine industry. So thank you all so much. We have quite a few slides of references. So I hope you guys learned something. Let us know if you have any questions. And again, thank you. Have a great day.